These are 4 minutes.
I would like to reiterate the fact that doctors are the professionals that the public should look to for advice, help, and comfort. Doctors are professionals for a reason. They have been through medical school for a long period of time to be where they are now. The public in any social class has a low chance of knowing much about healthcare, at least not as much as physicians do. Yet, physicians are in the workforce with weak points on subjects such as psychological and mental care, palliative care, and knowing the options to help effectively. How is it that physicians like these that are present in the United States are given the power to offer euthanasia? The Oregon model has no boundaries or laws to prevent such corruption or ignorance of physicians. They are not required by law to know about palliative care. This is a scary fact. We should be skeptical because we are dealing with human lives and there are patients with terminal illnesses that are persuaded that they aren't worth living those extra months, not to mention the fact that expected death dates are inaccurate. Instead of assuring, calming, informing, and encouraging the patients for those extra days, months, years, physicians will offer euthanasia because they're just incapable of helping. This is very ironic. According to Herbert Hinden, a number of physicians who received the training sufficient enough to properly care for patients have publicly expressed their regrets over having previously euthanized patients because they had not known of any viable options. This is a huge indication that physicians that are going to be handling patients wanting euthanasia should have sufficient training in knowing what to do, but they are not required. This will prevent malpractice. Also, suicidal thoughts, according to a British medical website, is a feeling people may have when they are no longer able to cope with an overwhelming situation, which could be financial, the death of someone, breaking up, or a devastating or debilitating illness. In this case, the illness and financial costs are the overwhelming factors. People who have survived suicide attempts have reported wanting not so much to die as to stop living, meaning the will to stop living was stronger than the will to die. Sounds like it is the same thing, but they are completely different concepts. Put this all together, and we have two opposing miscommunicating things. On one hand, we have doctors that are incapable of helping. On the other hand, we have every patient that have suicidal thoughts searching for euthanasia. When they are uninformed of the possibilities and care that can help them not feel that overwhelming feelings, they don't know how to cope with it, and there are doctors that aren't supportive. It takes a knowledgeable, rational, sympathizing doctor to logically plan an effective course of action. Not this proposed model from Oregon. I would like to close from a quote from the International Task Force on Euthanasia and Assisted Suicide. Laws against euthanasia and assisted suicide are in place to prevent abuse and to protect people from unscrupulous doctors and others. They are not and never have been intended to make anyone suffer. Thank you.